I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Today's program is a wonderful program about a very important issue. The issue is our health and our health insurance. We're pleased to have this conversation focus on MNsure. MNsure is Minnesota's process for implementing the Affordable Care Act. They call it Obamacare. What does it mean? It means that our people can get insurance that we can afford. Scott Lights, who's the CEO of MNsure. Let me ask you to focus on two questions you brought up. One, you mentioned the March 31st deadline. And unless people think that if they don't get it on March 31st, they're out of luck, let's clarify that. What does the March 31st deadline call for? What are we trying to do? What must people do? And what happens beyond that? And which classes of people or groups of people are most directly affected by the March 31st deadline?
So the March 31st deadline applies to all Minnesotans or all people around the country that they have health insurance coverage by that point. But I want to make a little bit of a distinction there in this sense. After March 31st, people, if you don't happen to meet the deadline for whatever reason, people are not able after that point in time to actually purchase commercial health insurance coverage until the open enrollment again in the fall. That'll be in October. But if people are eligible for public health insurance programs, whether that be Minnesota Care or the Medicaid program, they are able to enroll throughout the year. And even if, for example, you happen to be enrolled in a commercial plan and they have a situation changes, a job is lost, or something happens that income changes, we certainly can accommodate enrollments into the Medicaid program beyond that. Vice versa, if you happen to income out of a public program, there's opportunities to enroll into a commercial health insurance product as well.
So what are the target numbers? What are the goals for the state in general and for the African American community in particular?
Well, overall, we're at 107,000 right now. For the open enrollment period, which ends March 31st, it's our goal to have 135,000 Minnesotans enrolled. What we've discovered is that the mix of people who are enrolling looks a little different than what we maybe had anticipated back several months ago. We have a lot more people enrolling in public health insurance programs, which is actually really good. They're coming into very good coverage at low cost to them. We'd like to have some more people coming in on the private side, and that's what part of the outreach is doing. You know, by community, we haven't established specific targets, but I think one of the things that we do know is that because we have opportunities that exist because of the disparities that we know are existing around the state in terms of both coverage, access to coverage, and actually enrollment, that's why we have to work really, really closely with you all to ensure that we're doing everything that we can to support your outreach efforts.
Thank you. Let me turn to Reverend Alfred Babington Johnson. Reverend Babington, you know, you've led our community in organizing, mobilizing the legacy institutions and church institutions so that we could be at the table, so that we could deliver value to our parishioners, to our community members, to our families. How important is this collaboration?
Well, I really want to appreciate the question because I think it recognizes that everything we're involved in is more complex than just some simple on-the-surface activity. In a sense, health care and health insurance is a presenting issue. We need to be insured. We need for insurance to be affordable. Beyond that, the issues of the disparities that we face on every front will not be solved unless our entire community gains strength and starts to relate to one another on a variety of issues in ways that are life-giving and life-bringing. So as we have presenting issues, it's important that our response to them is consistent with strengthening our community in broader ways. So the inclusion of legacy organizations and organic instruments of our community in achieving health insurance is not a trivial matter. It's important for achieving insurance from trusted voices and trusted conduits, but also from continuing to strengthen our community. So to me, that's the import of the collaboration.
And welcome back to Conversations with Al McFarlane, a special town hall meeting at the Minneapolis Urban League. Our topic is MNsure. We're pleased to have major stakeholders in delivering health insurance to our community. Please welcome Stella Whitney West. She's CEO of North Point Health and Wellness, a legacy institution in North Minneapolis. Bill Tyndall, her counterpart for Southside Medical in South Minneapolis, and Adair Mosley is the Chief of Staff of Pillsbury United, who's directing the MNsure outreach effort there, and Mitchell Davis is the Health Intersection Director here at the Minneapolis Urban League. Thank you all for being here. Thank you and your organizations for the leadership and service you provide. Let me start with Stella Whitney West. Thank you for being here, Stella. How are you?
I'm great, Al.
Good. Talk about, thank you. North Point has always been a major force advocating and delivering health and value to our community. Why is it important that we mobilize our community to understand and use healthcare insurance right now?
Well, and thank you for that plug for North Point. I think that, and some of you may know us as Pilot City. So we have been in North Minneapolis going on 46, 47 years. And so happy to be in good company as a legacy institution and an institution that is governed by the community with a community board. So the importance of making sure that our people and our community have health insurance is that when you look at the number one cause of bankruptcy is because of health costs. And when you look at the fact that it's not a matter of if you are going to need to go to a hospital or to a doctor, it's a matter of when. And so oftentimes people think that they're healthy, they didn't have any chronic disease and that everything's going to be fine. But, and all of you know the stories of people that get in an accident. You think, okay, my car insurance is going to cover. No, they don't. And what happens? The hospital, the health institutions are going to come after you, and they will get their money. So number one reason for bankruptcy is healthcare costs. So that's number one. Number two, you want to make sure that when you have health insurance, you're able to go in for those screenings, for the preventative care, so that you can catch any illness or any problem early on when it is easier to treat it, and it's cheaper to treat it. So those are the reasons that we need to have the health insurance.
Let me ask Bill Tyndall, your colleague from Southside Medical, to weigh in on the same topic. What's your experience, Bill, in our people having insurance or needing insurance, and how does MNsure fulfill a need, create a response to a critical need in our community?
Well, from what I can tell, when people don't have insurance, they don't seek health care. And they'll pay their bills, they'll pay anything they have to do to have a roof over their head, or if they don't have a job, to get food. But people normally don't seek health care unless they have a really health issue. But at Southside, what we have tried to do, and many of you may have seen our mobile community van where we go out in the community and try to do preventative things. We do blood tests, we do BMIs. And we thought, when MNsure came along, we thought, wow, this is a great opportunity for us, because we had been, as an organization, supporting our outreach department without any funds from anybody else except for our grant to do that. So this is an opportunity for us to do two things: sign people up right away. And we've done a really wonderful job of that. Maybe you don't know that, but we've been one of the highest signer-ups in the state. We have increased our staff to do that. We have 2 people at each of our 4 sites that sign people up. We have 4 people in our outreach department that sign people up. And in any event we go to, we are able to sign people up for health care. It's one of the most important things that people have, and it gives people security when you know if there's something wrong, you can go to the doctor, one. Number 2 is important, and I always stress this to people, it's important to do preventative care. And I use one story to tell people that when I was a little kid and we lived in St. Paul growing up, my mother would always take us in the spring to have a dental check and in the fall to have a physical. And through my whole life experiences, I've always done that. And I always encourage our staff and people to do two things in life: have a physical sometime in the year and have your teeth checked sometime in the year.
Stella, you've got some navigators here, I believe, on your team. Would you introduce, I believe I met him earlier today, Brother Marcel Lynn.
Mr. Marcel Lynn can fill us in on that, and I will ask him. So we have two navigators here, and Marcel will introduce and talk about their work and the other navigators that we have. Thank you.
Great.
Thank you for having us here. Thank you, Ms. Stella, and thank you, Al, for inviting us here for this conversation. First, I'd like to say I take this kind of personal. And I say that because I'm a Northsider. I grew up here, raised here. I knew this. Across the street, there's Pilot City. Used to run the streets over here. So when I see people come through the door, these are my people. They're me. I'm them, because this is where I'm from. So I'm a Minneapolis kid, born and raised. So this has been, at first I didn't think how important it was until I started seeing the people coming through the doors and the faces. Some were friends. So I started taking it a little more serious that this is something that was important to our community. And I didn't realize how many people out there did not have health insurance, that did not go to the doctor for years. And some of those people have health conditions that they need to be seen. So I've taken it on a more personal role and a personal task, like these numbers we're talking about. We had a goal, and I'm trying to reach that goal any way I can. And I'm not trying to step on anybody's toes, but we want to collaborate, like what Mr. Mitchell had invited us a few weeks ago over here at Urban League, to help them out. And I think that's what MNsure wants, and I think that's what we need here in the community, to gather together and to help one another out, and not to be competitive, Mr. Tundle, but we're going to be competitive with you. We got some numbers too. And we're doing pretty good. And I think we're number one in the state, really. But with that said, I think with North Point, we're unique. We're unique in a way that we have a team of navigators that speak French, that speak Hmong, that speak Spanish. Did I miss anything? Somali.
Thank you so much. Let me turn to my other panelist up here, Adair Mosley. Adair Mosley is the Chief of Staff of Pillsbury United. Adair, good morning, good afternoon. Thank you for being here. Talk about your organization. Pull the microphone to you and talk about your organization and your approach to delivering health care insurance to the people that you serve.
Yeah. Good afternoon. As he's mentioned, my name is Adair Mosley. Pillsbury United Communities is an interconnected kind of agency of neighborhood centers, social enterprises, and innovative programs. And certainly health and nutrition is one of our focus areas within our agency. So we really saw this as an opportunity to, and mission fit for our organization to be a part of MNsure. We have 5 neighborhood centers that are focused, that have navigators in them, and they're, throughout Minneapolis and some of the core neighborhoods. Many of them, all of them, have access to over 18 languages. We have interpreters to help assist in the enrollment of this. We know that 5% of the population drives over 50% of healthcare costs in America. And so part of that is changing the behaviors of individuals that come that are looking for access to health care. So our work, specifically in our agency, is about those preventative programs, having people being connected. That's so important, that people are connected to their peers and other people that looked like them. And as was mentioned in the film and by Mr. Johnson, that the church is an important place to do that, and it has been the foundation of our community. Specifically, I have Mary Pargo here, who is from Oak Park Neighborhood Center, and we have 2 centers here in North Minneapolis, Oak Park and Camden, that are making inroads in the African American community. But as an agency, we know that healthcare is not monolithic, communities are not monolithic, and so that we really have to have different approaches in all of our communities. We've had a vast amount of fairs, resource fairs, to connect individuals. We have 4 coming up in the month of March for our last push out. So yeah, we're excited to be a part of this. And although we're not a legacy kind of serving African American organization, we do represent many communities of color, one certainly being the African American community. And some data that I had looked at in terms of the communities that we're serving. 15% of African Americans have no health insurance, and this is Minnesota statistics. 30% of Hispanics have no health insurance, and 22% American Indian. And those are all communities that we're working in to drive those numbers down. And so I applaud the efforts of everyone that are here, and that we do know that it's a collective approach for our community.
Thank you. Mitchell Davis, you've been at this for a long time in your career at the Urban League as the head of the health intersection, but also previously in state government, heading health initiatives for communities of color. How is the Urban League attacking the problem? What's the strategy here at the Urban League to make sure we deliver value and enrollment to health care for our people?
The mission of the Minneapolis Urban League is to link the African descendants and other people of color to opportunities that result in economic success and prosperity, and that we also advocate for policies that eradicate racial disparities. We know racial disparities happen in health, happens in education, happens in workforce, and also happens in financial literacy, banking, wealth accumulation, all across that variance. So the Urban League in particular takes all 4, we call them intersections. Every one of us here today, you have gone through one of those or all of those. And to make it in life, we have to crisscross and go through all 4. So we have 4 of those intersections of health and education and workforce and wealth. Now, how does that come all together when you talk about MNsure? One of the things that excited me about MNsure was not so much the digital footprint, not so much the web, not so much all of that technology to get people involved. Because those of us who have worked in that, you know it's plagued with glitches all the time. But what connects us on the ground, the Urban League has been around since 1926 or even longer. So that's a long time to have presence in Minnesota. But what's unique is that we're combining all of those, taking those footprints, and then saying we must bring people, come along, our families, our friends, our children, our grandparents, our aunts and uncles, come alongside and let's sit down and let's work on this together. So the computer certainly is a very important component, but we also need to make sure that this is understandable and that the Affordable Care Act starts to work for all of us.
Yeah. Mitchell Davis, thanks so much. Let's introduce your Navigator team. It's important work. You've got great people.
Well, I want to really applaud and say that Angela Williams is here today as our certified navigator. And Angela, if you'd introduce yourself and say some words to our group.
Hello, everyone. As Mr. Davis just mentioned, my name is Angela Williams. I'm one of the MNsure navigators here at the Urban League. I'm very honored to be in this position. Healthcare is very personal for me as well, Marcel, because I'm a new Minnesotan. I just moved here July of 2013, and as soon as I got here, I fell ill. And I had to have a major surgery, and the doctors took very, good care of me and everything. And I'm glad that I did have the health care that I acquired when I was here. And so it's very important for African Americans to take care of themselves, to go to the doctor, to get the help that they need. And so being a navigator, I can, help them with that step, make that next step, into securing their family's health. And so being a navigator, you know, I get to not only go through the system with them and helping them choose their health plans, but I get to listen to their personal stories. You know, I get to meet their families, I get to meet their children, and that's just such a wonderful thing. And so given that opportunity, we've opened ourselves up here at the Urban League to do to do enrollment 6 days a week, Monday through Saturday, and Tuesdays and Thursdays, we're here until 9:00 p.m. And also, and Saturdays, we're here until 1, from 9 to 1. And so we're partnering with several organizations, like one organization here, Accountability Minnesota, to, you know, be accessible for them and their clients as well, who may not know we're in the building. So we partner with them. Also, we have a computer lab next door with about 15 to 20 computers that we're going to be using and holding educational classes so we can get our community educated, get them enrolled, and get them healthy and fit. And so I'm really, really glad, and I'm so happy that I'm in this position. Also working for a great person, Mr. Davis and Ms. Makita Norris, my outreach coordinator. She's wonderful and very knowledgeable. So I'm just so happy. And I thank you, Mr. McFarlane, for this opportunity right now so we can get the word out, because the African-American community is really, really, like he said, there's only 22% or something like that that's enrolled. So we got to kind of break that. I mean, that's not enrolling. We got to, you know, kind of break that barrier. It's like throwing a brick through the glass, you know. So I just thank you again. I can't thank you enough. So.
And we can't thank you enough. So I'm pleased to introduce the Honorable Tony Carter. She's the Ramsey County Commissioner. Tony, thank you for being here.
Thank you for inviting me.
And I know you are passionate about healthcare, and you want to make sure that our communities and our counties and our states stay on point in delivering results for our community.
Absolutely.
What do we need to know? How do we best organize ourselves so that we take advantage of the opportunities at hand?
Well, I think that so much has been said, and I appreciate what we heard already from a number of the partners that are doing this work. It is really important that the African-American community take this on as its own work. It's not about what can be done for us, but it's about our recognition of how important it is to ensure that we have health care, that we are healthy, and having health care is a very important part of being healthy. But that won't happen just because it's there. It will happen because each one of us is a message to everyone in our families, to everyone in our neighborhoods and our organizations, and that we actively take part in doing that outreach to make sure that all are brought in is very, very important.
What's happening in Ramsey County in particular around the role?
Around enrollment.
Around enrollment.
We are participating just as our entire community is. Typically, Ramsey County and the counties have had responsibility for those individuals who fall underneath a certain income guideline. And that still is true. The counties are responsible for enrolling those who qualify now for medical assistance. And that includes people who had been on MNsure before, because that guideline has increased. So we think we're responsible for about 10,500 individuals, or new cases, I should say, in Ramsey County, and that represents about 27,000 individuals who, as a result of the Affordable Care Act, will be able to have care through medical assistance. So we're working against that. We have trained our staff, and we have been aggressively working through the issues that everybody else has been working through, like problems with access with MNcare, difficulties that people have had getting in. But you know that they can enroll on the website. You know that people can enroll by phone calling. They can also come into Ramsey County, into our East Kellogg building, 160 East Kellogg, and enroll. And we have people who are out and about in the communities as well. We know there are navigators out there and organizations helping, but I consider it a county responsibility to make sure that those folks for whom the qualification guideline allows Minnesota, or I should say medical assistance coverage, that we get that done. So we're in touch with Dorothy Day Center, the Hub Learning Center. We've been at La Clinica, Eastside Family Center, Plaza Latina, and the Rondo Library doing this work, as well as engaging libraries as outreach sites as well as those number of organizations who have this responsibility for getting the word out. We are actively targeting African American and young Latino men who are between the ages of 19 and 34, because we know that that is the population among which there is the most uninsured. And so we're reaching out to make certain that we get to those populations. I can't tell you that we've had the greatest success. We still have a lot of work to do.
Let me bring Scott Gray into the equation. Kind of wrapping it up, Scott, Urban League, pillar organization, a legacy institution, and represents the best and the history of doing good for our people. How important is this collaboration, and what do you see as the value of the Urban League leadership here?
Well, I first of all want to thank you for being a leader in this community. Happy Black History Month to you.
No, thank you.
Collaboration for me in this process started early on. And another stalwart leader in this community, Alfred Babington Johnson, really pulled us together because some of our organizations were left out. I must say that. We were left out and trying to figure out how to be a part of this process.
Well, explain that. That's important. I think it's important for our community to know
Well, I'm
the
trying to get
dynamics
there.
in the back. Okay, go ahead. Go ahead.
So we were left out initially, but we thought that it was best that some of our organizations come together. And under Mr. Babington Johnson's leadership, we were able to come together and talk to MNsure and even have a little chat with the governor to really help him understand how important culturally specific organizations should be a part of that. So I guess that spirit from the start is now moving us into the spirit of cooperation and collaboration where we really now need to get folks signed up. But I'm glad MNsure and others had a change of heart to make sure that we were part of the process. And so now we can go forward and do our work that we want to do in partnership with North Point and Stairstep and all the other organizations, and we don't have to fight over people. We're going to fight to make sure that they get in this program. And really, at the Urban League, we think health is a person's wealth. And so we will continue to move forward what we have to do. And hopefully, as I heard someone in the audience say earlier, that maybe there's an opportunity to extend the deadline as well.
Speak to the leadership of two of our stellar legislative leaders, Bobby Joe Champion, Senator Bobby Joe Champion in North Minneapolis, and Senator Jeff Hayden, along with their colleague in the House, Representative Rena Moran. Their leadership, along with that of Tony Carter, has been instrumental in making sure that the apparatus was aware that we were not being engaged properly. Talk about that, if you would.
Well, I would say that our team was probably the grassroots team, the team on the ground. But Senator Hayden and Senator Bobby Joe Champion were really took it to their colleagues to say this should be done in this state. We should be a leader, and we should include culturally specific organizations. They were very, I think a lot of us saw the commercials or not commercials, some of the editorials, some of the TV spots that Senator Hayden made some pretty sharp comments to the CEO of MNsure at that time, who did not have it all together. And he let her know that we can help her, and she should really consider making sure that we're a part of it. So the two of them have really played an instrumental part. And I see them, anytime that they're lined up, I want to line up right behind them.
Sort of summarize, give some marching orders that you have and that you want our community to adopt so that we are effective in delivering health insurance to our community.
Sure. I want to also just add that that this is about economic development. I know we're talking about health for folks, for our people. But we, as agencies, have been able to create jobs and opportunity. We have you and Mr. Rhodes, who are able to do some business with MNsure, and we want to make sure that our community although we're working very hard to get folks into healthcare, which is much needed, we need to make sure that the dollar is spent with us as well. And I want to be sharp on that, because there is going to be a lot of money spent with MNsure, not just this year, but next year and down the line. And we need to make sure that we can create some businesses or expand some businesses from the services that they can provide to make sure that MNsure is great for everybody.
Thank you all for being here, and let's keep working. Thank you.